Good evening, everyone, and welcome to our presentation on ethical conflicts in the OR setting. My name is Mark Herrera, and I will be discussing the first part of the DNR orders in the surgical setting. Before we start, I'd like to introduce you to two of my colleagues who will be presenting with me today. First is Bryan Ashley, who will be discussing the second part of the DNR order in the surgical setting and the first part of the elective abortion. Next, we have Ashley Zepeda, who will be talking about the second part of the elective abortion. Let's begin. Our first topic is about DNR orders. What is a DNR? DNR stands for Do Not Resuscitate. It is a medical order that instructs healthcare providers not to perform CPR on a patient in the event of cardiac or respiratory arrest. The order is made by a patient or their representative and is intended to respect the patient's end-of-life wishes. In a given situation, the ethical dilemma is the conflict between the patient's right to determine the extraneous measures and the healthcare professional's duty to preserve life and avoid harm. To make an informed decision, it is essential to gather all the relevant information about the patient's medical history, their DNR status, and the surgical procedure they are undergoing. The stakeholders in this situation include the patient's family, the patient, the healthcare professionals involved in the surgery, and also the hospital and medical facility. Evaluating the available options based on the ethical principles of autonomy, beneficence, non-maleficence, and justice is necessary to make a decision that respects the patient's autonomy, promotes their well-being, and upholds their principles of professional conduct. Finally, it is essential to implement and evaluate the decision, making adjustments based on the new information or feedback received, if necessary. As a surgical tech, it is important to respect a patient's right to make decisions about their medical care, including whether or not to undergo certain procedures, such as resuscitation measures. This includes honoring a patient's DNR order during surgery if they experience cardiopulmonary failure. It is the responsibility of the surgical tech to communicate the patient's DNR status to the surgical team to ensure that the patient's wishes are respected. If a patient has a valid DNR order, the surgical team should not initiate resuscitation measures unless there is a valid reason to override the DNR order. The expected outcome in this situation is that the patient's wishes are respected. The surgical team act in accordance with the DNR order. Although it can be emotionally and professionally challenging for the surgical team, it is important to remember that they have upheld the patient's right to make decisions about their own medical care. It is crucial to approach each situation with empathy, compassion, and commitment to upholding the patient's rights and wishes. Now that we covered the steps to approach and the course of action, I'm pleased to introduce our second presenter, Bryan, who will be discussing the moral obligation and code of ethics for DNR orders in the surgical setting.
Surgical technologists have a professional moral obligation to provide safe and effective care to patients, uphold ethical principles such as autonomy, and act in their patient's best interests. They play a crucial role in ensuring patient safety during surgery by utilizing their expertise, working effectively with the surgical team to minimize the risk of complications. In any situations where a patient is unable to make decisions for themselves, surgical technologists may have a responsibility to advocate for their patients' preferences and values. Overall, surgical technologists must fulfill their responsibilities and obligations as healthcare professionals, including providing quality care and advocating for their patients' best interests. The Association of Surgical Technologists, AST, has a professional code of ethics that outlines the responsibilities of surgical technologists toward their patients. According to the code, surgical technologists should prioritize the patient's safety and provide high quality patient care while respecting the patient's rights and autonomy. This includes honoring the decisions regarding their own health care, such as the right to refuse treatment or to have a DNR. Elective abortions, the first thing above all is the patient's needs. Patient's needs need to be met. If a surgical technologist does not want to participate in elective abortions, they can speak with their employer about possible options to be taken for them to avoid the situation. Other actions that can be taken for the surgical technologist is to be reassigned, taking care of other duties or other cases. Now I'll be sending it to Ashley Zapata.
Thank you, Mark. Thank you, Brian. Personal ethics. As a surgical technologist, we will have duties that don't qualify for our own personal ethics. While finding a new employer, we will need to let them know what we are and not comfortable with. As a surgical technologist, we need to provide the highest level of patient care possible. Patients should be able to feel compassion regardless of whom and or what the circumstance is. With that being said, as a surgical technologist, each duty is different. With that, we can go ahead and specify what we do and do not want to participate in. Each employer is different. So if the employer thinks you are the right candidate for the job, they will go ahead and let you know. So if someone does not want to participate in abortion, it should be stated in the interview process to avoid any miscommunication. Professional Code of Ethics. In 1973, Roe versus Wade paved the way for women to have the right to choose to have the abortion. Pregnant people in California have a fundamental right to choose to have an abortion. The right is protected under both the U.S. and California constitutions. On June 24, 2022, the U.S. Supreme Court overturned Roe v. Wade, which recognized that women have a constitutional right to abortion. The AST does not specify that it has an issue with elective abortions, just that the surgical tech needs to maintain a high standard of professional conduct. As a surgical technologist, we need to maintain the highest standards of professional conduct and patient care to respect and protect patients' legal and moral rights. With that being said, each person has different beliefs, but as a surgical technologist, we do need to follow the code of ethics in the medical field. Thank you.